All right, doctor, so we were talking about bunions. When is it time where you say, I need to consider the surgery? And I may not want it, but I need to consider it.
Great question. Well, that's a very individual answer, and this is what I tell my patients. When the pain that you're having from your bunion is interfering with your quality of life on a daily basis, when it is restricting your activity on a daily basis, or when it's restricting your shoe wear, or lesser reason when the simple cosmesis of the appearance of the foot is causing you distress on a daily basis, then I think it's time to consider surgery. You can't start making that decision until you know what the surgery involves. So it's very important that I explain that to my patients, and then they can take their symptoms, the recovery, and weigh up whether it's the right time for them.
And we're going to talk about what the surgery involves, but I want to go back a little bit and be more detailed, because a lot of people hear that when it starts interfering with your life. So let's give a simple example.
Sure.
Soccer mom goes to school, drops off the child, and has trouble even getting to the field with the child. Or abuela and abuela, they can't even make it to the driveway. Specific examples that would say, okay, enough.
Yeah, good point. So examples are when you go to when you get out of bed in the morning. Your first step, if it's painful, that's bad.
Just like that.
If you go to put your shoes on in the morning and you look at your shoe and go, oh, I can't put that on today, bad sign. When you go to the gym and you say, well, what can and can't I do today because the bunion's interfering? The bunion should not be doing that, interfering with your quality of life in that way. So they're good examples.
Those are great examples. And how long does it take to get to that point, doctor? Is it months? Because we could start with oh, it's bothering me, but you know, we're tolerant.
Yeah.
Women are tolerant, so are men, but more women than men. But how long does that take?
That's an individual thing as well, but generally months to years. A bunion isn't the type of thing where you're going to feel pain one day and then 3 weeks later you're going to need surgery. And if you follow some of the tips we gave patients earlier about making them better without surgery, then you can extend that period of time.